For 2160 videos. This is arterial line draws. This is a little bit different than normal patient setup, but it's kind of the basic gist. So a few things that we're going to need. This is both a safety set and a stopcock setup with a transducer. A few of the supplies we're going to need. I like paper towels. This is just a personal preference. Alcohol. 2x2 gauze, a normal just sterile syringe. I like 10 ml because it gives me a little more of a volume. And then an arterial blood gas kit. Okay. The purpose of the paper towel is to put underneath my patient's arm where I'm drawing the blood gas from, so that if I drip on the bed, it goes onto my paper towel and not onto my linens. Okay, so we're going to start from the pressure bag up here. And then we're going to show the equipment and then we'll draw. We have a pressure bag here, which holds back the pressure from the patient. So this is our patient, which normally, as we are aware, would be our pressurized from the heart, but since we don't have a beating heart patient, since we have the pressure of the heart, well, that's why we have to have a pressure bag to hold back that pressure from the heart to prevent blood from coming back into our line. This right here shows the pressure of our pressure bag. You can either feel the pressure or else you can have it and pump it up until that green line shows you that you're in a good place with the pressure. You have a little stopcock here that can either turn off and release the pressure of the bag, turn off to this port to pump up the bag, pump up just like you're taking a blood pressure, or turn off towards the pressure bag in order to hold the pressure. We have just normal sterile saline in the bag for our fluid to keep within our line because we don't want any type of bubbles or air. This, then as we continue down, we have fluid down to our sterile line. And again, this is a different setup than a normal patient setup. We have two different sections because I want my students to do different setups. We have the safety set, and then you draw with the safety set, which is right here. And then we have the stopcock setup, the insertion site, which is technically right here, and then our patient. So if we were going to draw from this, and then the transducer. So with the transducer, this is where we would read the blood pressure. There's a little kind of like microchip or monitoring system, which would be where the blood pressure would read. That is where this monitor attaches, where the arterial line that connects to the monitor would connect, the arterial line. It is best to keep this at the level of the heart, because if it goes above for some reason, you're going to have a low blood pressure, or if it goes below, you're going to have a high blood pressure. So it's best to try to keep it as level with the heart as possible. This is the pigtail, which opens up that line so to allow to flush, and we'll bring that back in just a little bit when we learn to draw. We'll start with the stopcock setup. We'll take our gauze, our syringe, I open it up just a little bit, our alcohol, and our blood gas kit. Maybe. prep our blood gas kit. Close it. So you identify your patient, make sure you're getting the right patient, the right labs, everything like that. You take the cap off the stopcock syringe. And now this is when we need to be considerate of we are opening a line and we are at risk of exposing our patient to an infectious situation. So this cap you can either throw away and replace, or else sometimes I'll take it and I will place it inside my syringe and reuse it because it will be clean in here, either one. I'll take my syringe, place it on my stopcock, turn off towards my line. With the stopcock, wherever it's pointing is considered off. So we can turn it off towards our line. So I just remember any time it's pointed towards my little pigtail is my line. So we first want to point towards my little pigtail or towards my fluid. Then we want to pull back because we want to pull back on our waist. Because we want to get blood back. See, we're starting to get blood, and we want to make sure we get fluid, excess fluid that was in the line, excess blood, so that we can draw whole blood. After we draw and we get whole blood, we turn our stopcock off to everything, which is a little 45-degree angle. We twist this off and we dispose of this. I prefer to just throw it in a sharps container, which is totally appropriate, or a biohazard bin. Next, we take our blood gas syringe, dispose of your sharps appropriately in a sharps container, connect it onto the stopcock, again turn off to the line, pull back so that we get whole blood, however you need for your sample. Turn off 45 degrees again. Remove your sample and cap it. Next, I like to take my gauze, flip it off to my patient, pull my pigtail so that my little port is clean, because I like to leave my lines and everything all clean and nice. Off to everything. Take my alcohol clean to prevent any infection or any pathogens I might have exposed. Either take a new, or if I was able to leave my cap clean or sterile, cap it. Off to my open port. Come back to my pigtail on my transducer and flush my line until my line is clear of blood to prevent any type of clots in my line. Okay. That is the stopcock setup, which is this portion of our arterial line. And then over here, sorry, it's not the most sticky of patients. Okay, and then over here is the safety set. This patient, it's a little bit different setup. It's this portion. What happens is this all stays in one section, and what you're going to need for it is your ABG kit with the needle attached, and an alcohol wipe. Let's move all this. What you do is the stopcock looks a little different on the safety set here. You turn to open it. Down here on the bottom of the safety set, it's a little, you click it, you draw back, and you can see it draws back fluid and draws back patient blood. It should be drawing back blood, sorry. It's too much, sorry. Well, that's a little bit of a fail. It's because my line is too long and it goes through here. Hopefully when you guys get on hands-on, but the blood will come through here because ideally it would be right here, close to the patient insertion site. But you'll want whole blood here at the collection site. You then clean the site. Take your ABG needle. Go ahead and stab it. Draw back. Pull back. Close your needle. I want you guys to reuse this. Clean it. Open your syringe back up. Push the waste back. Close it. You close this syringe again so that it's pointing and is closed off. Otherwise, this will fill up when you go to clear your line with the pigtail again. Okay, I know that one wasn't the best example, but hopefully that kind of helps you guys out. And now it's time for you guys to get hands-on. Okay, thanks guys.